Hey everybody, Dr. Hagmeyer here, and today we're unpacking the connection between Hashimoto's thyroiditis and chronic pain. You know, millions of people worldwide suffer with chronic pain and fibromyalgia and rheumatoid arthritis. And so I felt this was a very important topic to really examine more closely and really do a video on. You know, having treated thousands of patients with thyroid disease, I know chronic pain is one of those things that affects most, if not every single patient and Hashimoto's suffer to one degree or another. For some, obviously, it's more debilitating than others, but nonetheless, it's an important piece of the puzzle, and I think it's an important clue to understand and further investigate the possibility as to whether or not autoimmune thyroid disease is a possible problem. For very, very often what we see, especially for people suffering with chronic pain, is that years of suffering and desperation causes them and leads them down the road to visit a rheumatologist. And very often, these doctors often check for rheumatoid arthritis, they'll check for lupus, they'll check for mixed connective tissue disease, they'll check possibly for some kinds of bone-related problems. And unfortunately, really just two things come about as a result of that, depending on really what they find. In some cases, many people are just sent home feeling like they're crazy, that there's nothing wrong with them. Doesn't explain why they're experiencing all this chronic pain. But others are sent home with pain medications such as Lyrica or gabapentin, or even worse, a 3-month supply of antidepressants in hand. And the sad thing about this is that none of these medications are great for your thyroid, okay? But they're even worse for an undiagnosed autoimmune disorder like Hashimoto's. And so this becomes a lose-lose situation. Years of taking these pain pills go by, and eventually these medications lead to new problems. They tear up your stomach, they cause all sorts of gastrointestinal problems and ulcers and bleeding problems. They cause a further deterioration of things like brain fog. And inevitably, they cause more pain and more fatigue because the underlying root cause was never addressed. Right? Now, I'm sure if you're watching this, this might sound familiar, right? If you're watching this video and you've been suffering with chronic pain, are you in more pain today or less pain today than you were a year ago or 5 years ago? And I would probably venture to say, if you're watching this video, just by the title alone, you're probably in as much pain or even worse. So the question becomes, is there a connection to chronic pain and thyroid disease? Well, here's the thing. If you look at this study below, this study was done in 2014. The study shows that patients with Hashimoto's, well, I should take that back. What it says is that Hashimoto's, first off, is the most common autoimmune disease, and it also states, and this is the most important part, that it is a recognized cause of chronic pain and fibromyalgia, and that's the most important point of this whole study. Now, if you don't know what Hashimoto's is an autoimmune disease that causes the immune system to mistakenly attack the thyroid. And over time, this attack kills the thyroid. It basically shuts the gland down, and so the thyroid no longer functions the way it's supposed to. Now, when this happens, you end up with things like weight gain and fatigue and brain fog, obviously painful joints. That's the whole purpose of us doing this video. But also things like inability to sleep. You have insomnia. Maybe you experience depression. And the list really goes on and on. So if you ask your doctor today if the chronic pain that you're experiencing is caused by Hashimoto's or thyroid problems, chances are they're not really aware of this connection, or they've never tested you for that. And that's a big problem, okay? How important do you think it is to get to the underlying root cause of why you're in so much pain? That's really should be the number one question. It shouldn't be about just swallowing these opiate medications and these various painkillers to make your body numb. The solution should be let's get to the root cause, right? Now, because Hashimoto's is the most common cause of hypothyroidism in the United States, if you're a man or a woman and you're living in chronic pain and you experience fatigue and weight gain, there's a very high likelihood that this chronic pain is coming back to an autoimmune thyroid problem. And that's something that you need to know about. This is the whole reason why I do these videos, folks, is to help you understand what's wrong with you and start putting some of the pieces together. You have to be a good investigator and a good researcher. So there's a couple things that I want to point out about this research paper that we just talked about, and honestly, many others like it. Number one is that chronic pain and fibromyalgia can be caused by an undetected autoimmune disease that attacks your thyroid. And again, that's called Hashimoto's. Number two, while that may be great news, identifying that your chronic pain is tied into an autoimmune disease of the thyroid, this is really only the first part of the battle, right? Getting the proper treatment is actually more important part of this, okay? Here is where so many doctors, even natural doctors, conventional doctors, really miss it, and they miss it big time. Simply taking thyroid hormones or trying to dial into the proper dosage of thyroid replacement or pain medication, that doesn't stop the autoimmune attack, okay? Again, the root cause of the problem, that's what needs to be addressed. So let me show you a recent blood test. This is a patient who demonstrates everything we're talking about today. This patient is 37 years old, chronic pain, lived in a state of perpetual fatigue, and described her mental alertness, basically, and focus, I should say, as if her brain was on fire, okay? Another doctor was treating her for fibromyalgia with gabapentin, and the question is was this doctor missing something? Well, the answer is, the whole point of me doing this video was absolutely. He was focusing on just treating her pain rather than the triggers behind the autoimmune disorder. He missed that, okay? And like I said earlier, the big issue here is that this was a case where Hashimoto's was the cause of the problem. Now, if you look here, you're going to see the blood test shows a normal so-called TSH, yet they have antibodies against their thyroid. Okay, it's not normal to have thyroid antibodies. Okay, that's a sign that your immune system is attacking your thyroid gland. What you're going to notice here is if you look at the TSH, you're going to notice the TSH is 2.7, and so that's pretty good. The free T4, that's 0.85, which again is within the lab's reference range. But if you take a look at the top number here, you're going to notice that the TPO antibodies are 718. Okay? Now, the presence of antibodies, again, indicates the immune system, it's primed up and it's already destroying the thyroid gland, or it's going to start destroying that thyroid gland. So, again, we talked about the diagnosis of Hashimoto's. We looked at some of the thyroid markers that can identify hormones, and I also stressed that if this is what's happening, the focus of treatment from a standpoint needs to be redirected on the immune system. That really needs to be the primary focus of treatment. Now, if you haven't watched any of my videos on natural treatments for Hashimoto's, I really want to encourage you at this point to go back and watch some of those videos, all right? Not only will you gain a much better understanding of why your thyroid's not working properly, but you're also going to understand how these problems could be causing chronic pain, okay? Now, in bringing this video to a close, a couple things I want to end off with, okay? Number one, first and foremost, I hope this video really just unravels, okay, one more piece of your health mystery as it's related to the connection between your chronic pain or fibromyalgia and autoimmune thyroid disease, okay? Now, again, if you're not sure whether or not you have an autoimmune thyroid disorder, okay, I recently did a video titled, "What kind of testing do I need if I suspect Hashimoto's?" Go back and watch that video. You can find that on my website, okay? When I look back to all the patients over the years that I've worked with, I think regaining health can be summed up in just a few words. Number one is you have to look at the big picture, okay? You have to be a good investigator who will look at the complex relationship that exists not only between the thyroid and the immune system, but all the other systems of the body, and really being able to bring those systems of the body together and look at how they all work together or against each other, okay? That's what you should look for when you choose a doctor who practices functional medicine. I hope you check out our website. I hope you look at our patient testimonials. I hope you watch some of the other videos and you just become encouraged about what you've learned today, because there's so much that you can do naturally to get your life back.